Thanks for staying with us right here on Sunrise as we continue in our health slot this morning. Of course, we're talking about childhood cancers in a quest to try and help children and families affected by this rare disease and really awareness on the early warning signs of childhood cancer. Now, cancers in children tend to be different from those found in adults, most often occurring in the developing cells like bone marrow, blood, kidneys and the nervous system tissues. Professor Janet Poole from the Childhood Cancer Foundation of South Africa, and she's also the head of the pediatric oncology at Charlotte Maxeke Hospital. She's joining us for a conversation this morning. If you have any questions on the topic, you can give us a call on 011-447-1742 or 011-447-1620. Professor, thanks very much for joining us this morning. So just to give us a brief overview so we get an understanding of exactly how common are childhood cancers in South Africa.
Well, childhood cancer is not a common disease. It occurs in about 1 in 600 children. So it is a fairly rare condition as opposed to adult cancer, where thousands of people are diagnosed every year. So it's not a common cancer, but it is much more curable in children than in adults. And the curability depends on getting the child to a treatment center as early as possible. And so that's where the early warning signs come in.
All right. So with that being said, I mean, being able to detect it as early as possible, but a lot of times that's not the situation. How do you actually go about checking for cancer in children?
So the signs and symptoms of childhood cancer are fairly really non-specific, which is quite a difficulty. But we have put out a list of early warning signs called the St. Silouan signs, and they list a whole lot of signs and symptoms that if they persist for more than 2 or 3 weeks in a child, then either the doctor or whoever the medical professional is should entertain the diagnosis of cancer and then do the appropriate tests. There's no screening test for childhood cancer. You can't go to a doctor and say, I want my child tested for cancer, because it's really not, that's not really possible, okay? It's not like pap smears for cervical cancer or breast cancer mammograms and that sort of thing.
Okay, so, but I mean, how can the parents be empowered to sort of like be able to know what are the things that they need to look like?
Well, for instance, there are a lump anywhere in the body that grows. Now, the most common place in the body is the tummy. So a swelling in the tummy, in the abdomen, can be an early warning sign of childhood cancer. It doesn't necessarily mean that it is, but it can be. Lymph glands in the neck, and then sometimes the most common childhood cancer is leukemia. So fatigue, easy bruising, nosebleeds that persist. So it's, one nosebleed doesn't make a childhood cancer, but if they have continuous ongoing nosebleeds, then somebody's got to think that one of the blood cells might be low. And then, for instance, for brain tumors, children who have start walking and then stop walking, or have unsteady walking, or headaches, especially early in the morning, or persistent vomiting, also early in the morning. All of those are signs of pressure inside the brain, and all of those could mean that there might be childhood cancer. And so it's really essential that they go to a doctor and they get thoroughly checked out, and the appropriate screening test be done for that kind of symptom.
So we know how aggressive, cancer can be in adults, and then the question just becomes how challenging it is to deal with it in children.
It is very challenging because it's not many people think that it can occur in children. So so they don't think about it. So really what the awareness is just to have it in as a possibility, so that you don't forget to test for it. I mean, there is one cancer in the eye, a retinoblastoma, that actually the first early sign is a white spot in the eye, or the loss of the red reflex. So everybody's got cell phone cameras and that sort of thing. So if you take a picture of your child and you see the one eye's got red and the other eye is a white area, that's a very early sign of the cancer in the eye. And that is really often not recognized at either a primary health care or even a secondary healthcare level as an early warning sign, and the parents are often just given eye drops for their children and sent away. But if they had been referred as early as that, then we could save the eye as well as the child.
So you're a children's unit at the Charlotte Macleod, and I'm sure you see different cases in the South African context. How are parents equipped to sort of like deal with the challenges that come with child cancer in the country generally?
Well, obviously it's a huge shock when your child is diagnosed with cancer, and cancer always has a bad connotation. They think, well, my child is going to die. So we have treatment units around the country who have a team of people. So it's not only the doctors, but also nurses, social workers, volunteers, and a whole lot of members of the team who counsel the parents and try and take them through the journey. And that's where the CHOC, Childhood Cancer Foundation, comes in. Because of the shortage of social workers in the country, especially in the public sector, they have initiated a program where they have put social workers into some of the major oncology units around the country. And so these social workers are part of the psychosocial team, and they counsel and help the parents with practical things, also with emotional support and that sort of thing.
So the other challenging thing around cancer obviously is chemotherapy, as well as the costs that could be involved. How does CHOC assist within that area?
Well, CHOC does not pay for cancer treatment, and all children can get treatment for cancer in the public sector, and it is good treatment. It's not inferior. So if you are on a medical aid, then you can go to some of the private places where there is a children's unit. But I think the most important thing is they're treated in a pediatric oncology unit and not just
a general
ward. And with a whole team of people that is geared towards treating the child of cancer.
So in terms of like the work that CHOC does, the impact that you would say it has in helping those families and the children who have cancer?
It has a huge impact. I mean, there's the emotional support. So CHOC was originally started as a parent support group, okay, but it's grown to include other things. For instance, we have CHOC houses around the country near all the pediatric oncology units. So if a parent is out of town and the child is well enough to not be in hospital, then they can go to these CHOC houses and then just come to the clinic every day for the treatments.
Also still have a family time.
It's like a home away from home. They're nice, they're houses in the suburbs and with gardens and that sort of thing. So it's really nice, and they're provided with all meals and activities for the children to do, and so that's one of the things that really helps the the parents who are from far away, because obviously the centres are only in the big cities,
yeah.
and then parents have to travel from quite far. And then the other thing is they provide is transport money for parents to come and go to for their treatment, so they don't have the burden of finding transport to and from home.